Hi, and welcome back to the Dr. Ramsey Show. Last week we didn't tape, Walker was sick, so we're back today, and this is the last show of the season. It's a very special show. The topic is for women, women who might have something called PCOS or Polycystic Ovarian Syndrome. It's the same thing as insulin resistance. We're going to educate you on what that is. But the reason the show is so special is we have a guest today. You know Angela. She's one of our nurses, Angela Colpaert. She's an RN, and she did a project for school on PCOS. And she's offering a free treatment. It's basically on lifestyle counseling for women who have PCOS. So you can call the office and schedule. I'm going to say this again at the end so you remember, but for you, there's free information on how you can improve your situation. What is the situation? So PCOS is prolific. There's so many women who have it that don't even know that they do. So PCOS is an endocrinopathy, not a gynecological issue. Gynecologists miss it, endocrinologists miss it. It's a very easy way to diagnose PCOS through a blood test. It has to be taken the week before your menstruation, so the luteal phase, or when your progesterone is the highest. Women who have their blood drawn that time of the cycle will have very low progesterone. They will have very low sex hormone binding globulin, which is a protein that protects our metabolism. And the risks associated with PCOS are breast cancer, uterine cancer, diabetes, heart disease, and now we're calling dementia or Alzheimer's type 3 diabetes. So we're going to go through all of this with you. But the most important thing is nutrition. So Angela's here to talk about that. I'm going to talk about it a little bit more also from the medical side, but I want Angela to share what she found, what she's going to teach you, and what outcomes that we can expect. Welcome, Angela.
Hi, guys. So yes, my name is Angela. You might recognize me from the lab. I work here, but I'm also in nurse practitioner school. I'm working on my family nurse practitioner license and a doctorate in nursing practice. So for my doctorate, we are responsible for doing some type of evidence-based project. So I partnered up with Revitalize here and focusing on women with PCOS. Have a passion for this group of women because it is such an important disease process to address early and often. So like Dr. Ramsey mentioned, nutrition is such an vital part of your care when you have PCOS. It's very preventative. So like she mentioned, insulin resistance is one of the key components of PCOS, that with inflammation. So lots of times women with PCOS have a hard time losing weight. They can do everything right, but still have a hard time regulating their hormones, regulating their mood. So the the research that I've done has shown evidence of the simplest changes in your diet and incorporating physical activity can make a huge change in your short health outcomes and your long-term health outcomes. So short-term, like reducing your weight if that's something that you need or you wish. Specifically reducing your waist circumference, which we know when it's increased is linked to poor health outcomes. And then improving mood, improving quality of life, improving some symptoms that are often seen with women with PCOS, like unwanted facial hair, again, mood changes. And then, like she said, the evidence shows that if you follow this dietary recommendations, which I'll get into a little bit, you can decrease your risk of developing things like diabetes because that is so specific to the insulin resistance, which is what the diet targets. So a little bit about what I would be doing with you is educating you on kind of what we talked about now, what PCOS means, what it means metabolically in your body. So that just means how it ties in with what you're eating. So an anti-inflammatory diet is what has been shown to work best with women with PCOS, helping to reduce those inflammation levels that we know are so burdensome, and in turn improving your insulin resistance, which also it has like a catalyst effect. It helps with your hormones too, which we know from Dr. Ramsey is so important to your health. So we'll be talking about all of that, very simple terms, very casual conversation, and like we said, it is free because this is for my educational project. And then I'll ask you to fill out some questions just to see the symptoms that you're currently having, how it's affecting your life, And then I ask that you implement some of the recommendations that Dr. Ramsey and I have kind of designed together to change your diet and improve your exercise from week to week for about 6 weeks. And then I'd ask that you come back and we'll have about a 15-minute visit filling out the same questions so we can kind of see, did this diet and exercise plan, did it help you reduce some of these symptoms like the evidence shows that it will?
Yeah, absolutely. And inflammation, right? Inflammation is at the core of every single disease.
Yeah.
If we don't have inflammation, we don't get sick, right? So it's such a big thing. And these women, this is what I find fascinating. 50% of PCOS women are obese, 50% are not. 50% are infertile, and 50% are not. 50% are hirsute, extra hair, and dark folds, like where the folds are. You can have dark patches on your skin. That's classic. You don't have to have cysts on your ovaries to have PCOS, which is so interesting that it's called that. I like to call it insulin resistant more so than PCOS because it's more descriptive.
Right.
And if we can prevent breast cancer, right? So the biggest thing to me, and the reason I say this is I reversed my own breast pathology with high dose progesterone. When women don't make progesterone, they have heavier periods, more moodiness with their cycles. They develop acne very easily. That acne isn't related to progesterone, though. It's due to aldosterone levels being high.
Right.
We treat those very well with nutrition. I also use some medications and hormones. And a lot of my patients that already have PCOS can definitely see Angela as well if you want more help with your lifestyle. But the biggest symptom I see physical that brings women in here is the acne that's caused by the inflammation.
Yeah, it's going to be very supplemental. So it's supposed to just build on kind of what you talk about with Dr. Ramsey in your visits, just getting a chance to have more of a one-on-one, dive deeper into some education. And I'll even give you like a take-home pamphlet that will give some recommendations on things you should try to eat. For example, we know fruits and vegetables are great for us, but there are some fruits that are better and vegetables that are better. And if you don't know that, it's hard to know where to start.
That's right.
And that's because every fruit and vegetable and every food we eat has a different effect on your glucose spike. And that's kind of what contributes to our insulin resistance and our inflammation. So kind of diving into that a little bit more, giving you a little bit extra time to discuss nutrition and know that this is something that Dr. Ramsey supports and thinks will help you in your
Absolutely.
health outcomes.
I think it's a great tool. And one thing you have to do is have a diagnosis of insulin resistance. If you have symptoms of it and you're not sure, you could do your blood test the week before your menstruation if you know when that is. And that's really the most it's the most, what's the word I'm looking for? Specific way to diagnose it. You won't diagnose it by looking at your ovaries on an ultrasound. You're not going to diagnose. If you're thin, guess what? Most doctors are going to miss it. And I have a lot of thin insulin resistant women that would never have known. Maybe they just have infertility. They didn't know why. And that's why you don't make progesterone. And then once we have your blood work back, we can make an immediate diagnosis. And you want this diagnosis because about 50% of women actually have PCOS and only about a quarter of them know it. So if you're infertile, you have acne, you can't lose weight, you have inflammation, you may have diabetes or have a lot of diabetes in your family, it's worth doing your blood test the week before your menstruation. And so the nutrition is such a big part of it. Giving progesterone is such a big part of it. And clearing the skin with food is doable. It's easier if we give you spironolactone. It's a medication that's used off-label to treat acne, and it works beautifully. What I find is most derms or GYNs use spironolactone at too low of a dose if they don't get the clearing of the skin. Or you can take longer and just do it with nutrition with Angela.
Yeah, and something that kind of goes along with it is lots of women with PCOS, they have such high androgen levels, like Dr. Ramsey mentioned, so higher than normal testosterone levels. That you see higher levels of testosterone in men, but you don't always see that in females. But in women with PCOS, you often do. So that's kind of a big target or an indirect target of the nutrition. While the nutrition that you're eating, it's not directly going to lower your testosterone levels. It helps to address that inflammation and that insulin resistance, which the evidence shows indirectly will regulate some of your hormones a little bit better. And that's kind of how we see those improvements in acne and in the hirsutism and the mood changes and even evidence have shown that long term, when these recommendations are implemented, it can help regulate your periods, which we know is important when you're trying to have babies and just get your hormones more regular.
That's right. And when Angela was talking about the testosterone, the reason the free testosterone is higher, and it's not always, it's like the thing about PCOS, it's not 100% anything. It's like 50% everything, which makes it really difficult. But the reason that we have high free testosterone is because our binding proteins are so high, are so low. Binding proteins bind to testosterone. So when it's not bound, it's free. And then we have more acne from that testosterone. So I love this program for women that you created. Yeah. I think it's going to benefit a lot of women. And they just have to be patient because it doesn't happen overnight. That's the biggest thing for me with PCOS women is it takes time.
Right. And, the program I'm doing is only 6 weeks, so it is very short term, but it's meant to give you like a trial period of what it would look like to implement these changes into your life. And I hate to ever say that it's a diet. My recommendations are pretty consistent with like a Mediterranean diet or a lifestyle of eating anti-inflammatory, but it's really a lifestyle, especially if you're trying to target these long-term health outcomes. Right. The 6-week mark just kind of gives you a frame of time. So, hey, if one of your goals is to lose weight or you feel like you need to, you're going to see that weight before and after, or your waist circumference. And one thing I really like is one of the tools that we'll use, it'll ask you about your mood, your confidence, other things that have shown to be affected by lifestyle changes. So even that scale, you can see, hey, this is how much this changed in 6 weeks, or maybe it didn't. And if it didn't, then we know, okay, maybe there's further tweaks that we need to make. But long term, you see, hey, this worked for 6 weeks. If I continue to implement this, I can help prevent future poor health outcomes. So yeah, it's a very sustainable thing. It's just coming in with the commitment to make those changes for yourself.
So you said not to call it a diet, it's a lifestyle.
That's what I like to call it, because I feel like we get in our head about, I'm going on a diet, which is so hard to do because no diet is sustainable to be on forever, right? I'm sure I've been on several diets, fad diets, which you realize they never work. So when you frame it as figuring out what the best way of eating is for you and just making that your lifestyle and fitting that into your life. So it doesn't mean you can't go out to eat or find convenient ways of eating. There's just special ways to make those food decisions, and we'll kind of go over that.
That's beautiful. What a gift. Yeah. What a gift. So this program will end in 6 weeks, Russ?
Yes. So if you're interested, I'll have you call the office. They'll have my scheduling available for you. From the time the video comes out, probably there'll be like a 2 to 3 week frame to give you some flexibility. You can schedule a visit with me. It'll just be 30 minutes, or I ask you to pan out about 30 minutes in case it does take that amount of time. And then 6 weeks from when you have the first visit, I'll ask you to come back. We'll have a little bit of a shorter visit, and we'll just go over some of those questions that we had. So yeah, you can call the office and they will help you set up an appointment with me.
And I don't know if you can tell, but Andrew's going to have a baby soon. Yes. And in the event that she goes sooner, she has Taylor Lofton to back her up in doing your follow-ups. Yep.
And we won't really need to do much education at the follow-up, so that's why it is convenient. She'll be here to help give some of those tools that I talked about to fill out. I also should mention that I will be offering a midpoint phone call about 3 weeks in, just to follow up with you and answer any questions that you have. You will have access to my email if you do have questions throughout and you want me to clarify something, but I'm providing that phone call so you can count on, hey, I'm going to get a phone call at 3 weeks. One, to help keep you accountable, keep you on track a little bit, and then answer any points of clarification and just see how you're doing.
It's beautiful. Yeah. Really nice. Yeah. I'm grateful you took this project on.
Yeah, I'm really excited. And I love our patient population here. And I think that it's just so important. I think it also just starts the conversation of, after this conversation, you may be wondering, maybe I do have PCOS. Maybe I need to go talk to Dr. Ramsey. I had never heard of that. I never would think to put these symptoms together. So,
yeah, absolutely. And I love treating PCOS women. And I learned from my teacher, so last thing I'll say, he says to us, you assume every woman has PCOS until proven otherwise, right? Every woman has PCOS until proven otherwise. And so you look at every woman as if she has it. Because if I miss it, I'm not preventing diabetes. I'm not preventing
Right.
breast cancer, not helping them get pregnant, all of that stuff.
Right.
Thank you so much for listening. I hope this was helpful for you. If you know any women that might need this information, please forward it. And I look forward to seeing you next season. And so if you don't get our newsletters, please send an email to walker@rfmpv.com. And you can sign up for the newsletters and you'll see when we're coming back in the fall. Thank you so much for listening. Have a beautiful day and have a beautiful rest of your summer. Bye-bye.